we've developed this website to talk about rehabilitation. But you've got a particular interest in cardiac rehabilitation. Can you say why that's the case? Why is that important?
So cardiac wise, my family's a little bit of a nightmare. So we've had a lot of experience with cardiac issues. Most recently with my mother having had open heart surgery and having to have an ICD fitted, and filtering down to me, I've got a distorted aorta and high blood pressure. So I have to have CT scans, and can't do certain things like weightlifting. Not gutted by that, but it still has an impact on exercise and returning to exercise, because as much as you want to do things, there's this nagging little thought of, hang on, can I do that? Because you can't, like if you break your ankle, you can see it's sore and you can go, okay, I must be careful of that, or it hurts when you do it. You can't really tell.
It's not the same fear.
You don't know. Well, there is a fear because you haven't got a feedback system. You haven't got a feedback loop of pain.
Have we gone until it's too late, do you think?
Yeah, until it's way too late. Oh no, that was too much.
Yeah.
Doesn't happen. You don't get a do-over with a cardiac problem. Hence the reason, I didn't say that Dad died at 56 of a heart attack. So yeah, we're quite well versed.
Clear and present danger.
Yeah, it's quite well versed in our family.
So, when you were getting back, because you've recently sort of started exercising more after your recent sort of blood pressure issues and cardiac issues, etc. I mean, without you being a physio, did you have a lot of anxiety related to going back to exercise?
Yeah, I did do, because if it didn't feel well, you're just like, is this my heart? And I know what I can do, what mentally I think I can do, but then I started doing it myself. I'm like, because I'm on medication, then my legs were hurting, and it's just that we went skiing, and I couldn't ski for more than about 100 meters because my legs were burning. Was that cardiac? Was that is like this really deep ischemic pain? Was that deconditioning? Was it cardiac? Was it the medication? I didn't know what it was. I knew it was flipping annoying because the kids were like, okay, mummy, we'll go slow with you. So you're just like, so you don't know what it is. So in the end, you're like, I'm just not going to do anything. Which isn't helping either, because the heart's a muscle and it needs to work, and it needs to work in the right way. But having had the issues I had, and then returning straight back to full exercise in the way I wanted to do it, didn't quite work out.
No? Why didn't?
Well, no, because I couldn't cope with it. So I didn't have the exercise ability to work at the level I wanted to work at. So I had to take a step back.
Quite demoralising.
It's very demoralising when your kids go, all right, mummy, take it slow. When you can't walk up a hill because your legs are hurting, and you're like, is this me now?
So you're still there now? Are you still?
No, because I've taken a more physio approach. Yeah, funny that. Yeah.
So
None of my patients allowed to laugh at that.
So what have you done then?
I went back to baseline setting. I went to a baseline, I obviously can't do this because my legs are dying. So with the help of my in-house physio, started doing some really low level stuff. So we started doing squats in the morning, just starting to work on the leg strength, because obviously with the time I had off because of the cardiac issue, it was about a year of having problems in blood pressure before diagnosis. So in that period of time, I'd stopped doing all the gym stuff I was doing. I wasn't running anymore. Every time I got unwell, didn't know what was going on. So I deconditioned in that period of time. When everything got
downward spiral.
Yeah, you do. So you do less, you're able to do less. And then the cardiac thing comes out and you're like, well, can I do stuff? So on physio advice, I went back to the beginning. I started doing squats in the morning, lunges, they're not fun in the morning, being nice to do them. And then I branched out from that. I started going with a friend to Pilates just once a week. To a fabulous Pilates class near me that just started conditioning me. And then from that, I started walking more. I mean, we walk our therapy dog Bentley first thing in the morning for about 45 minutes, so we'd start doing that.
But did you start off at 45 minutes?
No, I didn't. I think, how long did we make around the field? 10? Yeah.
It was quite fortunate though, wasn't it? Because he was a puppy.
Yeah.
And he couldn't walk for more than 15 minutes anyway, so we were kind of limited with that.
Yeah.
And it worked out quite well because we could only increase it. I think the advice we were given was that he should increase his daily length of walk by about 5 minutes per week, wasn't it? I think.
So something like that,
Or
5 minutes per week, 10 minutes, yeah, something like that. It was really small, wasn't it? As
So
a
we were
puppy?
quite restricted by that.
Yeah,
But it was
so
quite a nice way
It was
for
good
you
for me.
to.
It wasn't my fault.
You kept track with his fitness as well.
It wasn't my uselessness that meant we were only going for half an hour walk.
Which was easy because you
Yeah.
weren't giving yourself such a hard time then,
No.
I suppose.
No. So you're right, I'd forgotten that. We did that. We very slowly increased
Because
that.
it wasn't you were walking about 40 minutes before you started doing any leg strengthening
Yeah.
or any Pilates. I think it's important to emphasise the point that this was a really slow progress. You started on this journey probably about 18 months ago.
When did I have the
with the
CT
walking.
scan a year ago?
But Bentley's 18 months old
Yeah.
now. We had him in the September. This is now the March. So he's about 18 months now, that's right. So
Yeah.
we started walking him about a year last November.
Yeah.
And you only started in Pilates, what?
November,
last
October, November last
so
year.
there's about a year of regularly walking and
Yep.
progressively increasing your walking in small intervals before you had the confidence to start doing Pilates.
Yeah.
And you only started doing the leg strengthening probably about 3 months ago. Because again, you when you saw the doctor, the cardiologist, he said, "Oh, don't lift any heavy weights."
Yeah.
And you were really anxious about that. And you just had a complete blank to lift any weights.
You do though, do you? 'Cause
Until
you're just like,
until someone pointed out to you that, well, actually, every time you take a bag out of the car, you're lifting a weight.
Did someone point that
Every-
out? My
every time you
in-house physio pointed
Every time
that
you get out of a chair, you lift your
Yes.
body weight.
Yeah.
So, as long as you're not holding your breath and
Yeah, it's
and
knowing
going
that's
to-
the splinting.
then
But-
going to like a maximum output.
Yeah.
You want to, as long as the intensity of your workout is controlled, then lifting some weight is feasible. And,
But you know, it's a fearful thing. I'm a physiotherapist. I have worked in neurocardiac rehab, everything, intensive care. I've done all of that, and I live with a physiotherapist, and it was still hard.
and still you're anxious.
Yeah.
And I think that's probably why we wanted to do this video.
Yeah,
isn't
it is. Just to help people. I mean, we've put it to the test recently because Mother has been in hospital, and the things we put in place for me, we've put in place more for her as well, giving her, she didn't want to baseline set, didn't want to find her baseline.
That went wrong for her as well.
That went wrong, and she ended up back in hospital. So we put a Fitbit on her and gave her a target, and she was really gobsmacked because it's hard. You give yourself a hard time. I think most patients we have give themselves a hard time for failing, don't they? They're not doing what they should do. So you have this boom and bust, don't you? You feel like, come on, I'm a clever person. I shouldn't be like this. I should be able to be enjoying my life. And you try and go, I know mentally, come on, just go over it, just push through, work at that level, and then you back down and then things go wrong. And I think what we put in practice with that, and what we do with me having a Fitbit, my mum having a Fitbit, is like, right, this is your baseline. And you keep going. But as you said, 18 months down the line, I now do my Pilates. I do go to the gym. I've started running again. And I'm in a much better situation. Might even be about to join a running club. Thinking about that. Yeah, but it's taken a long period of time. But I feel like I'm a lot fitter to be able to do it.
But you've given yourself the time to do it as well, isn't it? I think watching your mum as well was, the things went wrong for her in quite a big way because she was overdoing it. And what the Fitbit allowed her to do is to meter her activity. So to give a hard limit that she doesn't go past.
Yes.
I think a lot of people who have Fitbits or see people using these activity monitors they think, oh, I've got to be doing my 10,000 steps. Well, actually, when you're coming back from injury, and especially from a cardiac perspective, it's useful in terms of limiting your activity.
Yeah.
Because if you're coming back from a twisted ankle, well, if you overdo it, you just get a bit of pain. From your mum's perspective, she was overdoing it and ended up in cardiac failure again. So it's with much bigger implications.
Yeah.
So it's been interesting watching her recovery this time around, because we set a really low level, didn't we?
Yeah, so 2,000 steps, strapped her to a Fitbit, which she listens to a lot more than any of us.
Yeah.
Sorry, Mum, but it's very true. But I can understand that, we're the kids. Set her a limit of 2,000 steps, and she was gobsmacked how little that actually was.
And we've just limited her to increasing her step count by about 500 a day.
500
steps per day, but per week. So
she did push it once though. She felt lousy, and then she realised,
but then she just regressed to her previous level. She tried to increase it. So what we said to her was, well, start off with 2,000 a day, and she was very comfortable doing that, because we knew she could do that from what she was doing in hospital, etc. Each week then we said, well, let's increase that daily step count by 500 steps. And week 2 she tried doing 2,500 steps but for the whole week. And then week 3, 3,000 steps. But she tried to increase it by 1,000 steps one day, didn't she? And she ended up feeling absolutely awful, because she hadn't organised her day very well and ended up doing too much.
But she's now on 3,000 and finding that actually she's learned that actually it's a bit too much. It's great because she can live her life a little bit. Her friends can take her out and she can do stuff with it. But actually she doesn't want to push it, because she's realised it's actually enough. So we said, we'll camp out at the 3,000 for a couple of weeks, then we'll go again. Because it's just like training a muscle. It's just like if you're training for a marathon, you don't just suddenly go and run the marathon. And if your heart has been compromised for any reason, whether it's just disuse because of inactivity, you can't just then go, right, I need to be working, I'm going to do 15,000 steps today. Your body just can't cope.
It's given us some confidence as well, isn't it? Because she's in control now. I think one of the worst things with any illness is when you're not in control of it.
It's really scary.
She's in control of her own destiny now. So plus she knows that if she's had a busy morning, if she's done 2,000 steps by lunchtime, she's got 1,000 steps for the rest of the day.
Yeah.
So she has a quiet afternoon, whereas previously that wasn't the case.
No, she was church warden. She discovered that her walk from her house to the church, which is very close, was actually 800 steps. And she was probably doing that sometimes 6 times in a day and saying, oh, no, it's not much, I'm just popping to the church. And I know this will resonate with a lot of people, because I do it, I get home.
Long-term, that activity, that is great.
It's brilliant.
And we want to get her back to doing that.
Absolutely.
But it's got to be a stepwise approach. You always see that, rather than a boom and bust approach where you do too much and have to take a week off. We want that daily, repetitive, consistent amount of exercise, and the consistency is key.
It is, but in that you've got to have your own life. So it's like you've got this pot of energy that you can use, or these pot of steps, and you've got to decide, do I use that killing myself trying to be superwoman to help out everybody I possibly can, or do I save a little bit for me? And that's often really hard as well. You feel like I should kill myself for everybody else, and I don't really deserve that saved bit. I shouldn't be. I work full time, I get home, and I was apologising to you for, I've been sitting down at Hobbs 5 having a cup of tea and watching the chase. And you're like, I think that's okay. The boys don't like the chase, they'd rather watch Top Gear with you, but never mind. It's hard to do that. So you've got that psychological things like, I've only got 2,000 steps. How am I going to do? And you're not. And you've got to maybe say no to people, and you've got to go. I can't do that. But if you're in our stage of life, that means saying no to the kids, or saying I can't do that. I don't want to do that. I feel like a complete failure. If you're like my mum's, if you're retired, you're a bit like, is this my life now? And there is a way through it, but to start with, it's really hard psychologically, I think. So that's my view. So we're going forward, and we'll see where we go. I don't think I'm going to be quite joining CrossFit with you yet, and I don't think I'm going to be doing any endurance marathons either with you yet. But I will cheer. Yeah. Never say never. Yeah. Okay.
Let's see.
Probably not. But yeah, we're going forward and we'll keep on building and see how it goes alongside everything else that has to go. You know, the reality is other things. I have to go for another CT scan. You know, mum with a cardiac, you've got to deal with that, but try and live and get your fitness back up with it, but over time.
So there will be, what we're hoping is there's going to be a couple of, a bit of a cardiac rehab strand to Physio in the Box. We're going to keep the musculoskeletal content coming along, but because of these recent events and how we thought it'd be quite useful for people to have this information, and so we might sort of keep on just dropping a few videos in, talking about cardiac rehab, and if there's anything that anyone wants to get in touch with us about and talk about, you know, that you want us to talk about in terms from a physiotherapy perspective, following heart attack or cardiac surgery, or I mean even early onset sort of blood pressure problems and exercise, etc. We're more than happy to cover topics, but so please get in touch with us. Thanks very much.
Okay.